Good afternoon. It's really good to be with you today to give you an overview of medical services to make sure that you understand that we are here to help you succeed on campus through taking care of your health. So, I'm going to give you a general overview about what medical service is, who we serve, how you can take care of yourself, schedule an appointment, and then what happens after your medical appointment. Again, this is who I am, a primary care provider at Medical Services. My name is pronounced Tamara, like camera, but with the T, and I'm also the assistant director for travel health services. So within medical services, we are a group of physicians, nurse practitioners, nurses. We have a whole list of people who are here to support you in being well. So many people are used to either getting care from their pediatricians or their general internists. And when you are on campus here, we serve as your medical home. So we want to make sure that you understand we are your first stop for your basic and primary care while you're at Columbia University. And we can also manage any urgent cares, illnesses, some accidents that you might have, trip and falls, sports injuries. We do want you to call us or show up at our office, which is on the fourth floor on John Jay. And appointments are the best way to get through to us, and we will absolutely go over how to make an appointment with us. Also, what's really important to know is our care team has a varied background, and so we understand where you're coming from in terms of culture and medical needs and medical concerns. Also, please make sure that you contact us before any emergency services. So we want to be there for you, and we want to prevent you from having undue medical costs by going to uh, emergency services if it's not an emergency, or even to urgent cares. But again, I'll talk a bit more about that a bit later. So here at Medical Services, we are serving full-time students and part-time students who are covered either under the student Aetna plan or other medical insurances, and especially if you've paid for the health related service fee. So what's important to understand is if you paid the health fee, you can be seen at medical services. It does not matter what insurance you have. And when you come in to see us at medical services, there is no extra fee to be taken care of by a clinician. However, depending on the insurance you have, if you need to see a specialist outside of medical services, if you need any specialty labs or labs outside of medical services, there might be an additional fee when you need to come in. Some vaccines might also have an extra fee, but if you need vaccines, we cover it all for you. So if you pay the full-time health and related service fee, but on a different health insurance plan, you are able to use our services. So how can I care for myself at Columbia? This is very important because your health is mostly self-directed. And here are some basic tips and healthy habits that we really would love for you to be mindful of. And we don't take for granted that you're already practicing a lot of these things. So basic hygiene practices is washing your hands with basic soap and water, and singing the birthday song to that will give you the amount of seconds that are necessary for you to really scrub some germs off of your skin. You can Purell your hands. We're in allergy season, we're in cold season, so cover your nose if you're coughing or sneezing, not with your hands, but with your arms into your elbows. If you need to go to class, be very mindful of how you're feeling so that we're not spreading germs or have your mouth covered if you're consistently coughing. We have a lot of students coming in for cough, and not all of it is from a bacterial viral infection. So I just want to drop a note that sometimes it's allergies. So allergy hygiene practices for some people, if they're sensitive to pollen or seasonal allergies, at night you may want to wash your hair before you go to sleep or cover your hair before you lay down in your pillow. So pollen or other allergens that gets in your hair as you're walking around in the street aren't sitting on your pillowcase and you're not breathing it all in all night long and waking up with congestion and cough and sore throat. We want you to get good sleep. That means sleeping at night in the dark and in quiet. So if you've had a practice where you've kept the TV on all night long or music playing all night long, studies really show that when you are in the dark, it helps to regulate the chemicals that help with sleep and help with alertness. And ideally, you're getting 7 to 9 hours of sleep at night. Naps are important, but naps do not take over from loss of sleep at night. Health comes from nutrition and a lot of different lifestyle habits that we're talking about. So when you're going to choose your food, think about fueling your body with great sources of protein, lots of clean water, colorful vegetables. So think about eating the rainbow when you're creating your plate, vegetables and fruit. They always say one apple keeps the doctor away. So let's make sure you're getting good fiber, good food, a snack, a sweet treat is okay every now and then, but the more you eat whole foods, the better you will absolutely feel. And we want you to keep your juices flowing. So move well through the day. And that means find something pleasurable for yourself to engage in during the day, whether that's taking dance breaks, which is my favorite. And when I get stressed out or I'm sitting too long, I throw on Beyonce for like 2 minutes and I move around a little bit, really helps to break up stress. If you're sitting for long periods of time in the library studying, maybe put on an alarm to hit every hour so that you can stand up, stretch, do some chair yoga. So it's not just about going to the gym and working out, but staying active throughout the day. And make sure that you're being mindful of your posture so that you're not creating neck pain, shoulder pain, back pain by hunching over for too long of a period. So neck rolls, shoulder rolls, making sure that you are breaking up any tension. And so many people are busy, 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 busy in university, but finding time to have fun is important, to spend time with your friends, family, even for your spirituality or your religious practices, making sure that you can carve a little bit of time in for that. And these are your baseline habits that are going to create health. Now, if you get sick, because we live in an environment where it's very hard to stay healthy all the time, and that's okay. But if you do get sick, we're here for you. So this QR code is going to lead you to resources on the Columbia Health website where there are some downloadable PDFs. And our main one that we typically use all the time is a cold care kit. So what should you do? What should you do if you have sore throat, congestion, cough? Some basic ways to self-care for yourself is there amongst other things. You can give us a call if you aren't able to take care of yourself or you're unsure. And our direct phone number is 212-854-7426. Now, our office is not open 24 hours a day. However, you do have access to a nurse, to clinicians 24 hours a day with this call line. So don't be afraid to reach out to us if you ever feel like you need more support because you aren't feeling well or there's other issues going on and you want to talk to a nurse. We're here for you. So scheduling an appointment. This is going to be really important. So again, we are your medical home. That means that we serve as your primary care provider and we really can cover everything that you need, including women's health. When you go on to the Columbia Health website, which is secure.health.columbia.edu, you will see your profile and you will be able to schedule an appointment on this exact screen. And you're going to click schedule an appointment. The next few slides are going to be screenshots of what you're going to see when you need to make an appointment. So you're going to click on this blue button, schedule an appointment, and you're going to have the option of creating an appointment with a provider at medical services or CPS. So we're going to go the route of medical services. And it's going to prompt and give you a question. Do you reside and live in, or are you currently in the New York metro area, really New York State? And that's because we have to make sure that the clinician that you are choosing or assigned to is covered where you are. And most of the clinicians are in New York State. And the reason why we ask this is because on the next page, you can actually choose the option for a Zoom or a telehealth appointment. So if you are not in the New York area and you are choosing to have a telehealth appointment, unfortunately, we may not be able to offer that to you. It really just depends. So you would be best served by calling us and letting us know so we can clarify for you. Now, it will ask, do you feel that your symptoms are possibly life-threatening? So, life-threatening symptoms would be shortness of breath, you having a lot of heavy pressure on your chest, feeling as though you can't breathe, dizzy, very dizzy, meaning like you feel like you're gonna pass out, excessive bleeding. If you feel like your symptoms are life-threatening, then making an appointment to come in probably is not the most appropriate thing for that situation. And if you hit yes, you will be prompted to call our campus-based EMS service. So that's the Columbia University Emergency Medical Services, the ambulance that you may have seen parked in on campus or around campus. So they can come and assess you and decide where you need to go for next care, whether that's emergency room or there's something else that they can do for you. And please note that that service is free. There is no excess or extra fee for that. And so to call CUEMS, you would dial 212-854-5555. Don't worry, I'm going to give you that phone number again. And I just really want everyone to understand that CUEMS is very different from dialing 911 on your phone. 911 is accessing the New York City emergency services. And if you need to call 911 because you're having an emergency somewhere else, maybe outside of the campus, or if you call on campus, there will be an extra fee for that service. So once you pass that screen, here are your options to create your appointment. So for medical services, you're either going to choose in person, which you would come to the fourth floor on John Jay, or a Zoom meeting, a Zoom appointment, so a telehealth. And this is where it's really important that you are in New York State. A few notes about the Zoom or telehealth appointment. You will get a Zoom link next to the appointment page to check in. So it's not going to be an extra email that gets sent out to you with the Zoom link, but at the date and time of the Zoom appointment, you have to log back into your health portal, which is health.columbia.edu, sign in and check in for the appointment, and then the Zoom link will be there. So it's going to be important for us that you are in a quiet and private space in some place that you can hear us and see us, and we can hear you and see you. So try not to schedule an appointment where you're going to be on the train. You'll have a place where you can select the reason for the appointment, but here where it says reason code, it may not fit what you need. So feel free to elaborate a little bit or specifically about what it is that you'll need us to address and support you with in that appointment. And the callback number is really important, just in case one of our nurses need to call you to clarify what's happening, if they need to ask you any more questions. And there is something that's very important for you to know with this is when we call you back, or if we need to call you, our phone numbers are listed as private. So if you have a block on your phone, that prevents private calls, we won't be able to get through to you. So sometimes if you are sick or if there's an emergency and you call our office, the health service assistants will ask us to call you back and we need to get through to you. So often if we do that, it goes directly to voicemail. So just be mindful of your phone numbers and what's accessible to come back. The medical services has a next day appointment setup. We really want to be accessible for our students. So when you go on to make your appointment, you'll see the appointments for the next day available for your primary care provider who was assigned to you. If that person isn't available, then someone on that person's team. And then if that person is available, then we have other providers. If you go onto this online system and you don't see any appointments available, don't panic. It doesn't mean that we don't have anything available. You just might need to refresh your page because appointments can show up by the hour. So for example, it's what time is it? It's a little after 2. So going onto the website, you may not see any appointments for 2 or 3 o'clock, but if you refresh the page, there could be appointments for 4 o'clock in a few moments as the system begins to refresh. So that's something to really be mindful of. And the reason why we do it this way is to have availability as soon as students need, but also to cut down on no-shows if students are making appointments weeks ahead of time. Now, if you come in and your provider needs to see you again, they can make an appointment for next week or the following week, or they'll have the health service assistant do that for you. So once that is done, selected, you have your appointment, you'll have your page to confirm your appointment, which will have the date and the time and the provider that you will be seeing there. If things change, maybe you made an appointment because you weren't feeling well, and then you wake up and all is well. You're not sick anymore. Please make sure you cancel your appointment and not just no show, because it opens it up for another student to be able to be seen. And this page is very important. With every appointment you make, we ask you to send us information beforehand. So when we're going through our day and we're looking to see who we're going to be taking care of, the pre-information you give us is going to allow us to put together some pieces to actually make your appointment a bit more clear for you and clear for us. So please elaborate as much as possible. Give us all your medications that you've been taking prior, and doses are important. Allergies that you may have. We also screen for food security. So don't skip over this. Help us out. Help us help you. So if you need some assistance with accessing food, fill this out and we can support you. Even if you don't need it, fill this out so that we know that you are okay. Also, to know if you make a travel health appointment, this is going to be the most important thing because we do have to research where a student is going, what climate are they going, what activities will they be taking before they reach their destination? What vaccines have they had in the past and what do they need currently? So if a person makes a travel visit and does not complete their pre-questionnaire, it just makes that appointment not longer, but the student may need to come back for several more visits in order to complete what they need for their travel. And here is where you'll get the barcode to scan yourself when it's time to check in. So you can either check in on the phone or when you come to the fourth floor in John Jay, there are kiosks that you can check in to let the medical assistants know, let the team know that you have arrived and we can start taking care of you. Your uh, confirmation page will also list your preferred name. However, if we print out a label for a specimen or an appointment label, it may not, most of the time, it doesn't have your preferred name on it. I say that so that if you're in the waiting room and you have a preferred name, but we call you by your regular given name, please don't be upset with us. It's only because your preferred name is not on the label. And then please let us know, oh, my preferred name is, so that we can correct ourselves with that. So, some things to remember. There are several ways to get in contact us to make an appointment that is going to be online. So, you can go through your health portal to make your appointment, and you can call us if you aren't able to find an appropriate appointment for yourself, or you really want to see your primary care provider. The emergency room should not be your first stop for routine care. You can call us after hours to get some assessment, to get assistance, and we can help to guide you to where you need to be. Lab tests, procedures can be billed to your insurance plan if you're not on the Columbia plan. So that's important to note. If you're still covered under your parents' insurance, they may get notifications of your care, notifications of your bills. We love when you stay with one care provider. So you will be assigned to a primary care provider. You can also choose your own care provider. So on this screen, you'll see the QR code, and there's also the bit.ly link where you're able to read through all of the staff's profiles and you can choose. And you can either come into medical services on the fourth floor and you can tell the front desk staff who you would like to be your care provider, your primary care provider, or you can call. But I would just recommend that you call and wait until you get through if you would like to make a change in who your primary care provider is. So that cuts down on a student seeing everybody in the office, especially if um, there are medical concerns that should have a great continuity of care. But sometimes students just come in just for urgent matters or they have questions, and seeing other care providers may not be an issue at all, and that's okay. So, what should you do if you don't see an appointment? Just to reiterate, check back in 15 minutes. You can call the office and we can see if maybe this is something really quick that we can help you and do a phone consultation with a nurse or a medical primary provider. And call us 212-854-7426. And what should you do if you're in an emergency or need care when the office is closed? Again, we are available 24 hours a day through our phone number. And if it is a true emergency, this is the emergency phone number that you're going to call 854-5555. That's to get CU EMS at your door. If you're off campus, 911, that's going to access the New York City ambulance service. And then the emergency room that is closest to us is on 113th Street in Amsterdam, which is the Morningside Hospital, and you'll see the big ER sign jutting out off of the building as you walk in that space. So there's plenty of access of care for you. So this is the aftercare hours, 24 hours a day. Just call our office. If we are closed, this number here is going to just triage to a nurse line, and someone is going to talk to you and figure out what you need. And if necessary, we'll also have us give you a call. This is another number, so please write down this number, 855-779-7132. We'll also get you to a triage specialist, but only use this number after hours. So after hours would be typically after 6 p.m. Monday through Friday. You can also check with an urgent care center that is in network with your insurance. So that means that you would need to check your insurance provider on their website, which will have a list of urgent cares. An urgent care center typically is not open 24 hours. They just may have later hours than us that you can walk into, and they also would carry an extra fee for seeing them that you typically would need to pay out of pocket at the time of service. So things to remember, if you have common ailments, you can probably take care of them on your own or with us. Check on the website for our PDFs that can give you some basic self-care tips. Call us, check in with us if you need support. So make an appointment, use the number to call and access care with a nurse or clinician as necessary. You don't just want to walk into the emergency room. Use our care. And if you are on a non-Columbia insurance plan, know that you may be billed for some procedures such as labs. And if you are covered by your parents will probably get notifications of the type of care you received as well. After the appointment, we want you to stay connected. So your clinician who took care of you will let you know what's the next step in terms of connection, whether that's through secure messages or through a phone call, or they'll make a follow-up appointment with you. They'll let you know if you need labs or prescriptions. So it's important to note that if we are sending prescriptions for any medical care, you must choose the pharmacy, and we'll ask you what pharmacy you would like to use, and we electronically will send the prescription for a medication to the pharmacy. We don't give you a piece of paper to take. And then you have to go to that pharmacy with your insurance card, your insurance information, to have them bill the insurance for your medication. The pharmacy will let you know if there is any extra fee for your medication. And it may be none, it may be a few dollars, but that will be determined between the insurance company and what medication you need. Also, your providers may give you refills on certain medications, such as contraception pills. And it's important to look at your package that you receive from the pharmacy because it will say how many refills you have. So you don't need to send messages or call the office for refills. You would actually just go right back to the pharmacy and ask them for a refill, and they'll have that available for you. Most of the labs that are deemed medically necessary and your care provider orders will be drawn here in the John Jay building, but on the third floor. So you typically don't need to go to a different location for that. And then lastly, if you are sick and you're missing classes, just note that the university does not require sick notes. And so medical services does not issue sick notes if you can't make it to class. So for additional support, especially if you have referrals and you're trying to find a specialist, this is an amazing guide, and I highly recommend that you take a moment and either scan this if you're on a computer and download this website or write down the bit.ly address because this is going to actually clarify a lot of questions regarding labs and prescriptions. And if you need a specialist, how do you find one? So please take a moment and write this down. An amazing resources. And I'm really grateful for Alice Health for creating this. And also, you'll have the recording, so you'll be able to access this again. All right. So let's see. Let's wrap this up. So most importantly, we are your medical home. And we want you to let us know everything that's going on with you. If you are perfectly healthy, just create an appointment for established care. If you need ongoing medical support, make an appointment so that we can continue to support you in your ongoing care. But prevention is the easiest and cheapest way of taking care of yourself and treating illness. And don't ever be afraid or feel foolish for calling us. There are no dumb questions. If you're Googling things and it makes you afraid, call us so that we can talk to you about what's going on. Okay. So here's our phone number. Save it. Call us. We want to be available for you, and we are absolutely going to take care of you.